Oh, sorry.
Juice for me? Thank you.
Oh, the two wrists.
Wow. One of your friends?
Maybe do a double take. I'm like, is that what he just said? No. It sounds really racist.
It probably is.
Yeah, you turned it in a while ago.
There's a lot of like old saying words that are just like,
Did I hear? Is that like regular?
yes, I think that one's mine.
Okay.
Yeah, this one's mine.
Okay.
Oh my
At
gosh.
the bottom of the table.
Okay. Thank you.
Yeah.
Okay, let's.
Let's go through it really quick.
Okay, so what blood counts? You know, if you're going to treat a patient with cancer and they're on chemotherapy. Okay. I'll take ANC or neutrophil count. Okay. Neutrophil count would be for infection or hemorrhage?
Infection is, I'm securing the question.
Yeah. I said I would take ANC or neutrophil count if you're going to for infection and platelet count for hemorrhage. Hopefully. No, that's fine. But you should know that, right?
Yeah.
So I'm not worried about you specifying it. Okay. What is the nadir point of chemotherapy?
7 to 10 days.
7 to 10 days, and it's when they're the very lowest. So we want to wait about a week beyond that if we're going to treat them at all. Of course, we're going to be in consult with their physician. Okay. I realized I might get a couple answers from angular colitis after I put it, but what is the most likely cause of it? Fungal. Sometimes there can be a side effect of bacterial, but fungal is the main thing. So what would the treatment be? It's not on this quiz, but yeah, like nystatin, clotrimazole, a couple of those. Okay. Okay, this was the online question. You are working with a patient who will be starting radiation therapy for cancer treatment in 2 weeks. I guess we talked about this right before. Should have gotten that. At today's appointment, the dentist will be extracting several of the patient's teeth. What is that to prevent?
ONR.
It should be future bone necrosis. Not saying that, well, that risk for oral infection would be in a lower level, but the reason for the extractions right at this point would be for osteoradionecrosis. When your patient has cancer, which of the following would require a med consult? Patient who is currently on chemotherapy, yes or no?
Yes.
A patient whose neutrophil count is below 1,000?
Yes.
Patient who has a catheter or port? Yes. All of the above. A catheter or port is kind of like having a shunt. So it's definitely at risk for getting an infection around the area. So it's something that we would want to check again. And so all of the above. Inflammation of a mucous membrane, often manifesting as an ulceration of the oral mucosa during chemotherapy, would be described by which of the following? Mucositis. Cancer that arises from immature blood cells that grow in the bone marrow and tend to accumulate in large numbers in the bloodstream would be defined as a type of leukemia. Which of the following treatment options would be best to treat a patient who has herpes simplex? What is herpes simplex? Is it viral, bacterial, or fungal? Viral. Have you talked about that in oral path? I'm sure you talked about that early on. Definitely viral. So acyclovir. List 2 oral risks that, okay, we talked about that ahead of time. Okay. Have any of you had a patient that has seizure disorder on their medical history yet, or epilepsy? Okay. Remember that music?
Yes.
Yeah.
So I have a quick question. I thought tonsillitis was fungal, not viral.
Which one?
Tonsillitis?
Yeah, that is fungal.
Oh, okay. Well, I thought you said viral.
No. Herpes simplex is viral.
Oh, okay.
No, you are right.
Okay.
Very right.
Thank you.
Sometimes you can get a bacterial infection that manifests kind of like that, where you get cracks in the corner, but it's not bite.
Okay.
There are several possible scenarios in the dental office that result in seizures. Local anesthetic overdose, hypoglycemia, syncope, and even hyperventilation. However, the most common scenario is simply a person who suffers from epilepsy. Epileptic patients are unique in that each has different degrees of severity of seizures, from small twitches to violent convulsions, and each have their own unique aura. By definition, an epileptic is any person who has had 2 or more seizures of an idiopathic nature in their life. When presented with an epileptic patient in your office, your dialogue history should accurately define the patient's type of and potential for seizures during your dental visit. The dialogue history for this patient should include: what type of seizures do you have? The most common type of seizure is the generalized tonic-clonic convulsion, commonly called the grand mal seizure. What anti-epileptic drug or drugs are you taking to control your seizures? All anti-epileptic drugs are central nervous system depressants. Commonly used drugs include Dilantin, phenobarbital, Depakote, and Tegretol. How effective are these drugs in controlling your seizures? Ideally, these drugs successfully prevent seizures from breaking through. The typical epileptic probably has between 1 and 5 seizures a year. What is your aura? The aura is a part of the seizure and represents the external manifestation of an area in the patient's brain depolarizing spontaneously. The aura can be visual. Before the convulsion starts, the patient might see rainbows. The aura might be a sound or a smell or an involuntary movement of a body part, but will always be the same. The aura lets you know that a seizure has begun. Have you ever had a seizure that did not stop? And have you ever been hospitalized for seizures? Most seizures do not last longer than 2 minutes and usually end in less than 1. The seizure lasting 5 minutes or longer is life-threatening and is termed status epilepticus. It is important to understand that even if the patient has been free of seizures for years, the potential is always there for them to have a seizure in the dental office, especially if dental fear is present. You must be prepared. Let's look at a situation where a young patient with a history of epilepsy is being treated, when suddenly he arches his back and his body stiffens. What you are seeing is a tonic phase of a seizure, a 15 or 20-second period during which the skeletal muscles are contracted. Soon the clonic phase begins, and the patient begins to convulse as muscles alternately contract and then relax. The first thing to do is protect the patient from injury and make certain that any headrest or pillow is removed from the dental chair to allow their head to extend. This simple step will help to maintain a patent airway. Then ask for the parent or guardian if they are available.
His mom? Yes, sir. He's right over here.
How long is this been going on?
About 15 seconds. And question them about the need to call 911.
Are you sure we don't need to call 911?
No, you shouldn't.
However, if the parent is not available, or if you do not feel comfortable with the situation, always call 911 immediately. Commonly, the seizure will end within 30 to 60 seconds. The moment it stops, we reassess the patient, P, A, B, C, D. Assess the airway. Make sure they are still breathing and check for the carotid pulse. Definitive care in this situation is to simply talk to the patient. Tell the victim where they are, what happened, and that everything is okay. Now, what if the seizure doesn't stop within a minute? What if the patient's condition progresses into status epilepticus? Let's look at the situation again, now almost 5 minutes into the seizure. Dr. Larry Prince from Tulsa, Oklahoma can tell us about this.
The seizure started as before, and my staff and I managed the problem the same way. I did wait a little bit longer before calling the parent in.
How long has this been going on?
A little over 5 minutes.
Oh, no, call 911, that's not right.
I'll just call.
And she noticed the seizure to be more severe. She asked us to call 911, and immediately I did so.
The dentist continues to protect the patient from injury until emergency help arrives, at which point they will take over management of the case.
He's had seizures in the past, but never one this long.
Just relax. Look over here. You can stand right here, okay?
Hurry.
How long's he been seizing?
It's been about 8 minutes total time.
Okay. He had a history of seizures?
He's had seizures since he was about 6 years old, but never one that's gone this long. Hurry, please hurry. Is he gonna be okay?
He's gonna be just fine. I wanna give him some medicine in his nose. Just stop the seizure.
Nicholas. There he is, but just have him right behind
It's okay. Alright, Mom, I'll have you stand right here. Here in just a few seconds.
Anticonvulsant drugs are administered intravenously or more and more commonly intranasally.
He'll stop in just a few seconds. He'll start slowing down. Ease up. It's gonna be okay.
Once administered, most seizures will stop within a few minutes.
Thank you.
You're welcome. It's okay. Shine right behind your nose. Vanessa, let's get him moved over to the cot.
Got it.
We'll get him on the monitor. We'll start an IV. In case he has another seizure, we can give him some IV medicines. Yes, ma'am. It's okay. He's going to be a little sleepy for a little while, Mom. Because the medicine I gave him makes him sleepy. Vanessa, we're just going to lift him up and move him right.
Okay, sounds good.
All right, buddy. 1, 2, 3.
Alright. These seatbelts, Nicholas. Baby.
It's okay. He'll start coming around in just a little while. He's okay. He's doing just fine. Now that we've got the seizure stopped, he'll start waking up in here in just a little while. He'll be real groggy, but he'll start responding in just a little bit.
Following the seizure, the patient will be assessed by the emergency response team and transported to a hospital emergency department for definitive care.
Mom, you're more than welcome to ride with us, okay? 1, 2, 3. I'm ready.
Thanks a lot, Mom. We'll keep in contact with you.
Thank you, Doctor.
That music is so scary. I get all this fun to see on my. Okay. Okay, I'll activate it. And we have a few today, so we're not at the beginning.
My internet is come out since we got it, but I'm here. I'm here.
Oh, it just goes with the day. Okay, well,
It won't let me.
I'll give you a little more. Are most people's internet working?
Yep. It's just they just locked us out.
It logged us
Oh.
out there.
It's going through Wendy. Going out the door. No? Okay. It won't let you? It's still. Okay, so if you have a seizure, it means you have epilepsy. Definitely not, because there's a lot of things that can cause seizures. And like he mentioned in the video, how they often determine it, especially if you have an idiopathic seizure. What does that mean? What's that term mean? Unknown cause. So usually as a child, people can have idiopathic seizures. Other things can be head trauma or fevers or different types of trauma, medication or drug withdrawals, a lot of different types. So definitely they consider having 2 idiopathic seizures before they'll classify it as epilepsy, and then they'll do EEGs and all as well, and more studies. So, okay. Okay, we'll also be talking about neurological disorders in the fall with special needs patients, and so we'll be talking about Alzheimer's, Parkinson's, multiple sclerosis, that's, myasthenia gravis. There's quite a few different ones that we'll talk about later, but for our purposes right now, as far as systemic diseases and what you might see in the near future, we'll just go over seizure disorders. It's a lot of terms. There's some oral manifestations, and of course always some things that we need to make sure if we need to modify treatment or send them for a med consult prior to treatment. I think it's good to understand what a seizure actually is. And what it basically is a sudden discharge of neurons and really disorganized electrical impulses. Usually our brain manages and inhibits disorganized electrical impulses like this. And so when it isn't controlling it, it's kind of like the heart when you have arrhythmias. When the heart isn't capable of controlling those pulses, then it goes into an arrhythmia. And that's why we use an AED to shock it back into normal heart rate. And same thing here. It's something that is not inhibiting its normal regular impulses. So it's sudden, and it depends where it is in the brain on what kind of seizure they have. So we'll talk about that a bit. Sometimes a person can be actually conscious, and then many times they are in a state of either unconsciousness or, like you saw in the picture, the tonic-clonic, or they're just either have some awareness or loss of awareness. So we'll just talk about a few of those. So we already talked about that. A seizure is definitely not a disease in itself, but a sign of a disease. So it's actually pretty high. 1 in 10 people will have a seizure sometime in their lifetime. More common in a child, and more common than in elderly people for other reasons. 2 million people have. There's just kind of reminds you that it's higher in childhood, 0 to 9, and then over 60. So again, idiopathic is what they consider primary. Usually that's what a child has. And then acquired, if you think of that word, acquired, something has happened to cause it. So again, most cases are the idiopathic or primary, and usually it's a childhood onset, and it usually has a genetic factor. After the age of 65, it increases again because there's a lot of reason for traumatic brain injuries, such as even a stroke, and tumors that grow, Alzheimer's, head injuries, temperature, infection, diabetes, drugs, cerebral palsy. There's a lot of different things that can cause it. Other withdrawal type of seizures are from either sudden stopping of heroin or cocaine or really heavy chronic alcohol use. So it can actually cause a seizure as well. So often when they go into drug rehab, they'll definitely give them some and less. So that's what an EEG kind of looks like, and that's after they've experienced 2 seizures like we talked about, or an MRI. And so the EEG, again, they're hooked up all over to see how the brain is firing or misfiring. Aura is, you've probably heard of that in the past, but it definitely, again, depends on where in the brain it is. They can have pain like a migraine. They can smell something that smells like a skunk or tastes, unusual. They can hear music or sounds, but it's also, like he said, or visual disturbances like seeing rainbows. It's always the same for that person. Not everybody has an aura ahead of time, but if they do, it's the same, and it's really helpful if they know what it is. If they start seeing rainbows, then they can tell you, I'm going to have a seizure. And you can see some videos where they actually are predicting and knowing. This I just find interesting, depending where it is, the visual area, auditory, speech, smell, taste, depends again in the brain where it happens. Just like a stroke, depends what part of the brain, or if hemorrhaging, then it goes to a larger area of the brain, causes a lot more disability. So types of seizures, we've had kind of the same classification for quite some time, 1981 to 2006, and then they just updated it. The biggest thing they do is change the names, so it makes it complex for those who have learned. But to make it pretty simple, I'm just going to go through the basic types, and the 2 big umbrella terms are focal, which mean localized in a small area, or generalized is on both sides of the lobes, both sides of the brain. And so I'm going to, and sometimes they can be focal in one area, and as the electrical impulses increase, go to a generalized, which then covers the entire brain, both sides. So focal means one side of the brain, so one lobe, and it can be just focal in a small area or that lobe. So it depends. So there's basically 2 kinds. Focal aware, where they're aware it's happening, or focal where it's kind of impaired. They're not sure it's happening, or they don't remember it. So focal seizures are more likely to be adults experiencing them. And again, they have, previous term was simple and complex. It's just, if you're at all familiar with this, you've probably heard of an absence seizure or a petit mal or grand mal. Now all those terms, absence is still here, but all those other terms are have been changed. Again, small area. They often have an aura with this. So this may be they remain conscious and they actually remember it. So again, you see the different areas of the brain that cause different responses. Now, when it involves one side of the brain or one lobe, they remain conscious, but it's impaired. They often don't remember it. And one of the more likely characterized symptoms is automatisms, which it's just repetitive behavior, like smacking their lips in a row, or there's even one where they just giggle. It just, repeatedly. So obviously, if you didn't know they were having a seizure, it would seem very apparently strange, and you wouldn't know what was going on. If you can imagine a child having this type, it would be cause for a lot of teasing. So review there, you don't need to see that now. Now we're going to just briefly say focal to bilateral, like we said, one side then extends to both sides and moves into generalized. Okay, generalized. This is the one that you just observed. And within the generalized, which is both sides of the brain, you can either have non-convulsive, which they used to call petit mal, little, or grand mal, big. So we'll talk about both. The main ones that we'll talk about, the non-convulsive seizures, is the absence seizure. And I'm going to show you the video of this because I think you kind of never forget this one. It's a good one to remember for an absence seizure. So absence seizure, remember, it's the entire brain, but it's non-convulsive, but they have no awareness of it, okay? It's brief impairment of consciousness.
Okay, everyone, turn to page 74 in your text. Who knows the answer? Kelly. Attention again. Now, I know you can do better than this.
Oh, pardon. Mr. Rossi. She just had a seizure.
I'm just waiting to snap the seizure. Not all seizures are the same. For more information about epilepsy and how to access support in schools, call 1-866 epilepsy.
Okay, you always remember that, right? But they used to this wasn't a diagnosis, you can imagine how a child would be treated if they're daydreaming again and they're not paying attention, and periods of staring off, and in the past they used to think they were maybe demon possessed, and so it was really hard. Now it's in these type of seizures can happen multiple times a day. The biggest problem with that is you're not safe when it happens. It's brief, but say an adult had that and you were driving, it would be a problem. It is more common in children, but the child has no recollection of it occurring. So no awareness at all. Fortunately, it's only for a few seconds. So that's, but it's a generalized. For some reason, they like to talk about the spike and dome EEG findings. So I just thought I'd show you a picture of that. Myoclonic, just so you are just kind of aware of that, is myo. What does myo stand for? Muscle. So it's a brief contraction of body muscles on both sides, so it's simultaneous. But again, it's sudden jerks or clumsiness. It's not like the tonic-clonic. And clonic, so tonic was when the boy started at the beginning and he arched and he was just really stiff. Then clonic is where the actual movement begins. So that's why it's called tonic-clonic. Atonic is the exact opposite. It's just sudden They call it a drop attack because the muscles, just sudden loss of muscle tone, which could be, of course, very dangerous as well. But they're not you just want to kind of know and be able to break that down and know what that is. But those are all generalized seizures, so the whole brain is being involved. Tonic-clonic, that's what you observed. I think has anybody observed a tonic-clonic seizure? You have? Okay. Yeah, I have not. I've seen lots of videos because I searched for some. There's ones with somebody skateboarding and their friends, and they just happened to be videoing. He fell, had a head injury, and he went into seizure. There's a whole bunch of bad language because everybody's freaking out because their friend is laying on the ground doing that. Understandably scary. That's caused by a sudden injury. But there's a lot of videos out there, but I've never seen one. I've never had a patient have one, so that's fortunate. Again, they may have an aura, that may or may not be. The crying out or the epileptic cry, usually I have you read that ahead of time. If you read it, you know that it's not a cry of pain. It's just that the diaphragm's air, when the tonic and then clonic phase, it presses the air out and it just makes a sound that sounds like a cry out. Some people have them, some people don't. But that's what it's called, is an epileptic cry. No pain involved, but just air being pushed out. They, of course, are unconscious, tonic phase, rigid, like you saw, and then shaking, 1 to 3 minutes. All kinds of things can happen. It makes sense when they're jerking that much. I can't figure out how they videoed that scenario because it looks like a seizure. So I do not know. I keep thinking, does he have epilepsy and they just waited? They wouldn't have triggered but I don't know how a boy could act so well to do, because that's exactly what they look like. But they can easily, if they fall, of course, they could break teeth. When they're moving like that, they certainly could bite their tongue. You might see bleeding, bite their cheeks. They may have scarring in their mouth from doing that. And of course, they're going to lose urinary control because they have no muscle control at that time. Postictal means kind of what you saw after you had the longer one, but they often can be confused for 20 minutes or so afterwards. That's a difference. Sometimes you don't know if somebody's had a drop seizure or if they fainted. That's a difference between a seizure often and fainting, is that once they come awake with fainting, they're awake. They're not confused. They're not disorientated. I mean, it may take them a while, but they're pretty quickly back on. Status epilepticus. So that's what you viewed in the last part of the video where the boy went past 5 minutes. So it's either continuous over 5 minutes or 3 or more in a row. Just barely stop and then start again, then stop and start again. So very serious. That can be life-threatening. And obviously, if somebody wasn't with that person when it happened, that's when sometimes you hear of fatalities with a seizure disorder. Okay, so that you want to know that word, status epilepticus. We're going to be talking about that with something with asthma too. So status means continuous, and then epilepticus, it's like an epileptic seizure, okay?
Is that of the full brain?
Yes. That comes from usually tonic-clonic seizures, so yes. Okay, let's go to our, since it won't work in my, okay, let's go to the next one. This is in your textbook. I wouldn't write it this way, but that's how it was. Oops. I know you guys love that. I know, no fun. Okay, yeah, I would say that's an aura. That describes an aura. But because auras are more likely to occur with a focal aware seizure, that is the correct answer. Okay. This should be a quick one. Do it in 30 seconds. Okay, so definitely generalized tonic-clonic. Let's see if we can get it all in the same one. That's pretty entertaining. Okay. So, any loss of urinary control, thrashing movements of the limbs, we're always going to put that into the generalized tonic-clonic. And you can have an aura. We don't know. Okay. This one you should get in 30 seconds as well. $29, $28. You want to know this one. This one's in all the board books. And so if I say it's in all the board books, then I probably mean it will be in all the quizzes and tests and exams. Okay. I know, you would think, I can understand thinking it's generalized convulsive seizure because that's the most worrisome, is injuring yourself. But the most life-threatening is going to be status epilepticus. Okay. Okay, I think everybody should take a 5-minute break. Second, wake up, get some air, get out of this dark cave, walk around, stretch.
Came back for the group activity.
Yeah, I saw you. I went, wait. Do you want to do it right now? I
Should
I
we?
should do it.
No, you're good. Oh my gosh. If you don't, let's do it. I don't think I got it. No, I'm. But if you don't want to respond to Monday, that's fine. But
I'll just let you log in tomorrow.
there's a 5. So I'm just asking everyone today. Okay. Yeah, it's
Logs out really fast, so.
That's good. Okay. Thank you.
Oh, this one has to be.
I can tell it was like a joke, or like you were actually really upset about it. Oh my gosh, Toby, you're in the quiz. is my video. Like, I was like, oh, why are you doing that? And it was like, everyone knew it was me, and like, they all started laughing. So, wait, there's a cool, yeah.
I do have a quick question. For one of the quiz questions, you mentioned that it was to prevent future bone necrosis, but you weren't specific in which radiation was it?
It was the online question. Did you read the online question?
Well, no, because I was like, the neurosurgeon said surgical extraction is necessary, and it's like reduced it, like it could prevent oral infection that could lead to potentially fatal to stomach, and then also prevent the reduced it to bone necrosis. So it could be, because
I don't know, did it say that there was radiation therapy in that one?
Oh, yeah.
it did, but it wasn't like a specific for cancer treatment. Was it more like
radiation therapy though?
But wasn't specified to the head and neck.
You're right.
So, because if you don't get bone necrosis unless it's like, you know, more specifically.
That is true.
So,
Okay, to think about. And then you need to add, okay, let's go ahead and do that. Let's add them.
I think you're good. Do you want to draw into the box?
It's blue, I don't know why. Okay, so you're going to...
The white guy.
Okay, so you go through, have you done this before? Okay, so wait, and then it pauses, it says, like, say yes, and then it will, I think, just when you go, yeah. So I'll let you.
You stop. Wait, what day? Sunday the 19th. Just a reminder. Oh, do it answer. That's when we need to do our RTs, guys. Because we have to give her our final number so that they can order and make the food. Oh, it will be Sunday. Oh, it's this Sunday? No, it's Sunday the 19th. It's the Sunday after Mother's Day. It's 3 Sundays away. Oh, I think it's 4 Sundays. Wow, it says right there. I am just. Wait, Megan, don't you leave? No, next time we can have the 10th, so I'll be back to the next one. Is this the next one up again?
It's Lolly King.
Twice before we break somewhere. What? So we'll go next weekend. Oh, I'm going to figure out. She's like 120 pounds. But we should do something like that.
Oh, for sake, yeah, I'm sorry.
You too.
Did you give her a plate?
Oh, we only have one, right?
I think so.
No, you don't. You just take an Equinox on the upstairs. It's like, it's
So
super
that's,
quick.
that is 36 milligrams, so depending on how much of it, did you use a whole cartridge or 3/4 or 7?
It's only on Wednesday
About
morning.
0.75.
So they can't just 2 weeks
So 36, and that would be 27. So what you just would do, it's 27, but yeah, since it's, so I,
which is weird, you know? So it showed up on Wednesday for the morning block.
Since like this,
it's okay.
None of that other did you do. So then you can just write okay at the bottom, because that's like if you
For
use
what?
orchids.
Or anything.
And then you could write no adverse reactions and AR.
Oh, you're not. Spent an hour on it.
So that will add. Now we're going to add.
Makeup something.
Yeah.
Okay, I think we could have done it right.
Yeah,
And add
I
tracking
talked
for
with him, like, chapters, and I think he wants to do like a PowerPoint presentation. I probably will add some like videos and like examples or like situations in there, but I think we're just gonna divide and conquer, you know, for the weekend. But for the hopefully I can get that out of the way today.
Otherwise, you just, so you're going to be doing this basically
And all the good stuff.
What, like
yes, I did, and then I just typed in anesthesia. It needs to be
I don't have any class, so I'm just gonna go home and like, I don't even know. Try to study something. I guess we have.
No, we do it in here. So, okay, I'm gonna, I watched it.
I think I'm gonna study half of the weekend, like for the majority of the weekend.
No, that's
farm like once or twice. Like in between, like just to switch it up. And then I'm gonna really study.
So I'm gonna give you a competency for the PSA and the GP. I want you to do one more nasal palate clean to really get that anesthesia, and then. And it's kind of like if you can do it where you're coming opposite almost. So the pressure anesthesia, that, and then when you start the pressure anesthesia, you far away from the inside. I mean, it's just, you know, once I told you, but I just want, that makes all the difference. And it's like a topical, like I said, but you want it across, and you want to make that
So you can
more anterior, a little bit. You don't want to come too straight.
Like I was too straight bathroom, I looked in the mirror and it was like I could see it twitching. Like my lower eyelid.
Almost
opposite. Staring
your hand and all that was
staring at
good.
the laptop.
Just your orientation and then that, and then I think
probably both. So I'm drinking water. I looked it up on my computer.
But I'm gonna. That was
stress.
close enough.
So like all of a sudden, like I have all these, but it's normal, you know. It's not like Pavlov. It's freaky. It's like someone's touching me.
So that's the one I'm going to just put that in
Yeah, it's on the little eyeball eyelid.
Just like,
yeah, because I feel like something's happening at it.
no, I know. Most of
You do like look at it and watch it. It's so weird, right? It's like there's something in your eye.
yeah, that would be
Like that's like
everything else.
the top. Yeah. So you're adding that's really
I should
that's like and we're almost done. I feel like if it was 4 years, it'd be more it'd be less stressful. But I guess it's worth it. I guess. I just want to figure out
this is how you get
That's why I Yeah, next year I'll have how to do it. Like I did like the case like yeah, last quarter, yeah.
Oh my, how do you do it right away? Because I haven't used it. You're like,
Oh, I'm gonna be I don't know, like you said like position or whatever, so to reflect on it. I really don't. They improved it. And then I added hours. You know, so it's on there, so oh, that sucks.
But you know, I know now that you will do
That's
that.
weird. Like we should have it like a signage sheet or something.
Yes, yes. And you knew,
thank you.
yes, you're welcome.
Thank you.
Nice long break right now. Yeah. Oh yeah. Finish early. Finish about 5 minutes early. Like no, it's not worth it. 20 minutes early. Yeah, that's really good.
It's coming.
Yeah, you have to have like, you have to have a good culture for this kind of classes. Yeah, too.
Okay, let's just finish this part up as quickly as possible. Sorry that took a little longer. Okay, have you talked about seizure medications?
Yes.
In farm?
Yes.
Good. I'm just listening. Has he talked about the side effects of seizure medication in farm, especially phenatonin, dilatin? Okay, that too. Some people may be very sleepy, lethargic, not care type of. Did he talk about the second one down? Phenatonin, dilatin, and gabapentin. The side effect is what?
Ataxia, dizziness.
Okay.
Nystagmus.
Gingival hyperplasia.
That's right, there's something.
Okay, I'll wait just a minute. It's vital that you know that for the boards. It's kind of old news, but they still like it, okay? So gingival hyperplasia, especially for phenatonin, dilatin, there's a few other ones too, but especially for that. As far as medications, most of them are going to be taking medications, but it could be, there's a couple things, they may get to the point where they don't need to take them anymore. They actually can get control. It does not mean that they've been cured of epilepsy. It means that they have gained control through medication and the doctor may take them off. So that's not a bad thing. But you do want to know if they're taking their medications. That's why I pound in, do you take them regularly and did you take them today? It is important to know if your patient, if they have epilepsy, if they have been prescribed medications, if they're taking it. They can have increased bleeding tendency, so we're going to definitely check, do 2 or 3 teeth, possibly digital pressure. We're not going to recommend aspirin or NSAIDs for patients who, that's why we have you soap medications too. While you're here, between your farm class and soaping, you start to gain a pretty good understanding of which medications cause bleeding. You won't be soaping in private practice, but you will have a good background on what medications cause. There will be new medications coming along, but at least you'll have good background. You'll know how to search. If you ever want to search, you'll know how to find out. Okay, so just like you talked about, may cause drowsiness, inhibit memory. Did he talk about possible reduction of efficacy of oral contraceptives with some of these? That's a pretty serious one. I would think the physician who prescribes it would tell the patient that. Other treatments, they may have huge type of, I know there's a moth up there that's adding to our PowerPoint. It's kind of nice. It likes warmth, but it doesn't know it may die if it flies in there. My son's friend, close friend, has 2 brothers, and one of his brothers has a serious seizure disorder, and they finally went in and did a major neuro surgery where they go in with focused doses and try to, almost like an ablation therapy for the heart, where they try to eliminate the stimulation in that particular area. And it definitely caused some personality changes for him. So it's a risk to do something like this. But it depends how serious the epilepsy is and what the quality of life is. So there it is. Here's the forever picture that will never go away out of your head. That's in your textbook. That's like worst case scenario. So sometimes they'll have periodontal surgery to remove part of that hyperplasia because even once it's there, it's hard to get rid of. If they have impeccable oral hygiene ahead of time, they're less likely to get the side effect of this. But often you don't see them until they look like this, and it's pretty hard to get rid of. I did talk to a neurologist. Oh, that is important slide. And he said they're adding folic acid now, and the patients don't have the side effect nearly as much. So that's actually a pretty cool finding they've had. So if they do have it, you pretty much watched it on the video. So the new thing is you don't just hold them down. Like he said, give their head room to move so they can keep a breathing area. But you don't want them to fall off the chair. You don't want them to hit anything around them. That's why they were holding them up above and at the feet. You want to remove all our sharp instruments. Ours are the worst, so you want to get them back. You want them in a supine position. If possible, they have, depending on the situation, you may need to turn them to their side so that they don't have tongue obstruction in the back of their throat, or if they do throw up, they need to be turned to the side so it comes out so they don't have obstruction to breathing. Passive restraint, so that's kind of open airway if need be. It used to be that they try to stick something in the mouth to hold the tongue down so it wouldn't go back in the throat, but they've realized it's better not to have anything in their mouth, and normally they will take care of that themselves if they have space to move, but it's best to be there and observe. And then he checked the breathing as soon as it was done, so you want to maintain airway and check airway. Then if you're going to record this in the chart, if this were to happen, you're going to record details. How long it happened, what happened afterwards. You're not going to let the patient drive themselves home. Okay, thought you had a question. Okay, there are your questions. You really want to know when was the last seizure. So when I always talk about establishing control of whatever systemic disease this is, medication use is going to be huge, and finding out when the last seizure was. Of course, you want to know the type, what, where, when, but when is a special must know on this one. Really would help if you knew if they had an aura and what happens. They'll probably may or may not want to volunteer all this information. Some people are very sensitive about having epilepsy. They feel like it has a label. I think that we have moved past that quite a bit, but it used to have a label, and people didn't want you to know. And neurological disorders can be tough for people to mentally handle.
So what if they had like focal impaired seizures and they don't know when the last seizure was?
Yeah, the focal impaired, yeah, they should know, because, well,
Like if they're by themselves?
okay, yeah. So that's why it's possible it could happen there.
Okay.
Definitely possible. And you just want to be prepared. Really, there's not much you can do except for keep them safe and recognize that if it continues, you're going to call 911. That's why I show you those videos. Hopefully that's forever kind of etched in your brain. Really, that's about all you can do. So, yes.
What do you do if you have like a patient who's had a seizure and they want to go home and they won't listen to you and you're like, you should call someone, and they say, no, I'm going to go home myself? Or...
Yeah, that it should not be allowed. I mean, if, you know, there's only so much you can do on restricting someone. When we talk about psych disorders, we talk about that as well. You can always, if it's an adult and you've recommended that and you've tried to call somebody and they just walk out, then I would call 911 and say there's somebody driving in this car, just had a seizure, probably not a good idea. That's what they tell you to do with psych patients. You're not supposed to restrain people, and that's not our job. We don't have the hold capabilities. So if you're really worried about it, that's when you would get backup help, but you can't restrain them. Even people with psychiatric disorders. You're taking a chance of also hurting people in the office, including yourself and otherwise, but you definitely make it known if you're really worried about it. But I agree that could be, I think most people have a seizure disorder know they should not drive afterwards, but I'm not saying that couldn't happen. And again, what medication, and do you take it regularly today? Very important. A lot of people have problem with computers or flashing lights, so if one of the recommendations, and this also is in the board book, is not moving your light up and down. You know how we adjust it a lot and try to make it, and sometimes it flashes in their eyes because we're trying to see and it just goes a little too high. Don't do that. I mean, just be better. You don't want it to go in their eyes, and you don't want a lot of movement with the light. That could definitely trigger one who's triggered by lights or computer screens, that type of thing. Okay, this is important. If the patient reports recent seizures, even though they're taking the medications they've been given, then that's a request for a med consult. If it's recent, they say recent is within a couple months. Within the last month is really recent. Yes.
Is nitrous?
That could be calming. It's not contraindicated. It could be calming because, like he said, the most likely reason somebody's going to have a seizure, or at least high incidence, is dental fear. So nitrous could be a good thing. Mm-hmm. Yeah, I didn't write LA with epinephrine, okay. Cannot be cured. We talked about this, but a lot of patients do become seizure-free after long periods of medications. So they may be taken off, but it can still happen. Okay. Tonic-clonic convulsive seizures are the most difficult to manage, but status epilepticus is the most life-threatening. It's an emergency situation. You saw the difference in the mother's reaction. To me, that was a really appropriate to help us know the difference. She was really quite calm and fine with the first one. The second one, she basically freaked out. So that's a pretty good way of going between a tonic-clonic that's going to last from 1 to 3 minutes to status epilepticus, where it's an emergency situation. Okay, let's do a few more of those real quick. We're going to okay. Oh, I'm going to go the next one. What's the answer to that? Yep, that's it. Oops. No. There you go. So which should you not do? You want to keep the patient from falling out of the chair. That's for sure. It's the way it's worded. Yeah. You don't want to let them. I agree. So that's a double negative kind of sitting. Okay, let's go. Let's see if we can get that to 0. Hurry up. Okay. Okay. Last one. Everybody had a chance to fill it out? Okay. So that's concerning because they're being treated, but they're still having seizures. So that definitely means they're not controlled. So that question, when was the last seizure and are you taking your medication should indicate that. Okay, just a quick okay, syncope versus fainting, syncope versus seizure. Usually you feel lightheaded before you faint. You may get all sweaty and white and clammy, and it's often, you're not going to faint if you're sitting down. Okay, whereas you could have a seizure laying down, sitting down, any of that. And you're not usually going to have urinary incontinence with fainting. It's usually short, and you're not going to be confused afterwards. Just that sometimes those two can get confused. Okay, sleep disorders were basically sleep apnea. I think most of you know what that is. You probably know somebody who sleeps with a CPAP. It basically is an interruption or absence of breathing at night, and then they have to gasp for air, and often they grind their teeth when they do that because it's a way to try to open up the airway. So you will notice, I'm actually amazed how many patients now have attrition and occlusal wear. It's a lot.
Is it due to America with the obesity as far as being overweight?
Certainly sleep apnea is partly due to that for sure. But there can be people who have it without that. But definitely it affects that, and it talks about that. Insomnia, everybody knows what that is. Narcolepsy, so disorder associated with uncontrollable desire to sleep during normal wake hours. That can make life very, very difficult, and it's a sleep disorder. So sometimes sleep studies help in determining the different things. Insomnia can go on for months at a time. That can be treated. Here's, so you've got 10 minutes here. Basically what I did is I posted a PDF file. It's a Dimensions of Dental Hygiene magazine. It's a journal that our association puts out. It's excellent. It has really good short articles, a lot on medically compromised patients. So come fall, I'm going to have you look at some different things, and also I'm going to have you each present something about a disorder you know of someone that has, possibly, if possible, of what we're studying in the fall. But this is really helpful. You have some questions to answer. You can either spend your 10 minutes right now getting as much of that done as possible so you don't have to do it this week, or you can leave, whatever you want to do. So that's all I want you to turn in next week, but know that the lecture notes is still what I'm basing that's your study guide, so don't turn it in. There's nowhere to turn it in. So, and then I will see you next week. We'll have a really good time, so you have to show up. No stress, no quiz. Okay, I know you'll be totally wiped out by the time you get to me, because it will be pharmacology, but we're going to talk about pregnancy and gastrointestinal disorders. Sounds fun, doesn't it? And we will do an in-class thing to wake you up at the end, a case study, okay? So have a really good week, as much as possible, and I'll be praying for you. And have a good weekend. Well, you won't have a good weekend, but try to sleep some.
So this is a group?
No, this is individual. I decided to do this because I was afraid you wouldn't get it done in class, and I don't want you to have to meet. It won't take you that long. So this is individual. Next week will be group.
And where is
It's in modules. Both of them are in modules. The last two things, the PDF and the sleep apnea or sleep disorder assignment.
This is not working for
AG, this is yours, right? I think you're the only one who's read it.
Yes.
Okay.
Oh, my name's
Yes. You were focused on getting it done.
Alright, you guys make sure your shoes are sharp.
Bye, you guys.
Have a good weekend.
You
Very sorry.
What room is it in? It is 4427.
442, okay.
Yes.
Where we were last time?
Yes. It looks like that's where it's going to
Be
5 p.m. a regular basis. I don't really like that.
Doing well. How about you?
Were you reaching for the chair and I gave you a hug instead?
I like hugs.
Okay. This is a really
What are you talking about?
I finished Alright. I finished the other one. I finished that. How many is it? Only that?
Yes. Oh, this is the,
Where are you? Okay, so this is one more part.
yes.
Okay, thank you.
You're welcome.
It's like
Next week. Yeah. You're saying bad words.
Did you have grandparents? I can't take mine till next quarter. I got mad. It's like, I was like, can I just and then I just want to get
in the summertime, it's last
yeah, I guess you're right.
I got ready to like, so I was like, I need I lost zero.
I wouldn't know what the colors. I think it's yeah, the cuisine. That's what I see. Yeah. No.
Daniel, I will look at that.
Yeah, just say the same.
I
Gotta keep it open, you know.
Yeah, keep it open.
But the actual
Because initially I had the first answer, and then I was like, well, what's a specific?
Didn't say.
Trying to resolve the question. Lawyers.
yeah. Yeah.
My brother wants to be a lawyer, and I take the test.
Well, it's just like,
I want to be just like right.
I'll tell you all what you did.
It was funny, his professor in college had to write like 2 letters, or he had to take 2 classes, and literally it was 2 different classes. The professor posted the same PowerPoint, so he just asked him like, do I have to go to both? So my brother literally never went to one class. It was like a 4-year class.
Probably so far.
I'll be able to finish this later.
Where you guys go, Denise?
I'm
Oh, okay. Oh, you almost drove to your laptop. Oh, okay. Okay, and then you have insurance.
So many types of that.
Yes.
Not you, I'm saying. Girl, I just got back in the first period. They sat at a table next to me at a restaurant and I didn't even recognize I didn't do
Oh, that's just the puzzle one.
That's right.
Oh,
No, even though we don't pay, it like comes out of whatever our money goes to. So I figured it's less.
What are you talking about, Ariana?
You go get it.
Oh, I'm not going. I'm not going.
And then plus you have to buy like a really nice dress. It's like I have my summer.
And that's the thing, my big sense.
They even put it on the paper. They're like, they're and whatnot.
The seniors, they're going to say, and they're coming to the party. Because they're halfway there.
Yeah. Go back. Plus they're having to drive like 2 hours. Like,
Try that.
yeah.
So you charge your mom and then
You can buy the same thing.
I'll buy my next dress next year.
I'm gonna fit into a nice dress next year.
After this chubby kid.
I'm gonna go other brand.
Are you gonna go right now, sir? Sophie's story. I'll see you later. Sophie, I have a story. Is she she's strong. It's I bet.
Don't let that like yeah. Does she abuse anybody?
Does she what?
Is she an alpha? Is she an alpha with the other dogs? No, the other dogs. Dude, you don't like us. My kids are working on them. I'll take it.
Let's go.
This way.
Come, no. Come on.
What?
No. And she goes, that's my favorite when she does that. Guys, you walk slow. I got wedges. Hey, we don't chew.
Her dog was in.
Your dog or her dog?
My dogs were barking at us.
They went to your house
Yeah.
and they were barking. My dog barks at everyone until they get inside the house.
But they're fine with other dogs.
Then it wants to play with them. It's like as long as you don't pass that front door, they don't like you. But once you pass that front door,
You have a Pomeranian? Is it a boy? The male Pomeranians are assholes.
Oh, really?
Yeah. Male Pomeranians are assholes. They don't like kids. They're like,
Oh, is that the one you said died in the pool?
oh no.
That's what he told me.
That was my aunt. Because before that, she had another Pomeranian, and he did not like. He liked old people. He liked people he knew. But like this little dog was mean. He's like, try to get you, dude.
sounds like you feel chihuahua.
It's like a bigger Chihuahua that's more aggressive. That's what a Pomeranian is. It's a long-haired Chihuahua. It's a bigger, long-haired Chihuahua that's willing to bite you. Because Chihuahuas won't bite you really. So it's like, they'll bite you as a last resort. But like a Pomeranian will be like.
If you did, see you guys.
Your parents can cover your belts. It's like almost sure it sounds like your parents.
So wait, so he was conscious?
It's a sleep disorder.
Hey you guys,
Yeah, he was.
tonic-clonic, are you conscious during the seizure?
Did that kid look conscious? That was like, I can't stop. Like,
Tonic-clonic, the little boy was tonic-clonic.
That was
I
a
thought she
tonic-clonic.
was saying the skateboarder was tonic-clonic.
Well, you shake either
that's
way.
she was thinking myoclonic. I think she got it mixed up. Myoclonic is like if you like imagine like if like half your body did this like.
I'm sorry. Wait.
Exercise.
Okay, yeah. Yeah. Not aware.
Sunshine, were those, thank you for posting that. Were those, like, you think those are the same, those pages? Are they the same, Daniel?
I don't know.
Oh, your guys' book? Or our, wait, what?
Art for reflection, it's due. You posted
Yeah, I
pages?
posted the pages.
Yeah.
Well, I don't know, because I posted the pages that Maddie said, so I didn't actually look myself to see.
Are you talking about for your group? You're
Yeah,
wondering what the
reflection.
pages are?
Well,
Monday.
yeah, we have a reflection.
No wonder you
No,
were
we
like-
just have a reflection.
Yeah, whatever.
Those
Where
are-
am I? What were you asking me though?
Those are the pages of the reflection,
I
right?
think so.
If not, Adele has a book.
Adele has the book.
Oh,
If you need to take pictures.
Oh, yeah, we'll take
Well, I'm already in the trash can, so these are my pictures bad. They're just piling up.
How much was the book, Adele?
I was taking pictures. Yes.
How much? Oh, you rented it. Okay.
No, I didn't look at them.
I was gonna say if you bought it, I'd shoot you $5 or something.
I don't even know what I'm
Look, we're talking spin dodging bullets, but
Just take a video.
Fourth is brace.
What would you even call that to look it up? Braid?
I literally look up brace.
Like you take a picture? Yeah, scan it.
What side effect does seizure medication would cause?
Whether it's scanner
I'm struggling. Where's the
Should I redo this one? No, what? I've never seen that before. I've never seen that before. It's like, you're the one? Oh my God. You need that one? Come on. No.
How many pages is it? 10 pages? That's a lot.
Who's presenting next
But
week?
you can control mine.
You are? No, you guys
Somebody else
presenting.
is not.
You're presenting on Monday? Who's in your group?
Me, Laura, Jessica V,
You're presenting next week?
yeah, we're presenting on Monday.
Monday? Okay. Good presentation, I'm going to participate.
Oh yeah, it's still really on.
Yeah, we need to get off our phones.
Oh, I mean,
Yeah, there's more participation in this. There's more.
Yeah, she would totally get cut off the teacher.
Yeah.
hey, I was wasn't there for that. I was like,
So I got guilty for no reason.
no, you weren't paying attention.
Well, she cut him off. Remember, he was talking and she.
I was paying attention.
Because no one was, because we were just, letting him go off. And then she was like, okay, so I didn't know what was happening. I was just like, what's happening? I feel like I'm in Twilight Zone. That was an interesting last week.
Yeah, I'm on.
Did your best.
Because over three, I'm like, is it even a question?
Yeah, you can find it.
Signs and symptoms of sleep paroxysm.
And page 23, it means 23, like not the number at the bottom, but the number at the top of the screen. So like, so 23 is really 21, if you know what I mean. So like the bold number.
It's the slide number.
Yes. So you know what I mean.
But what are we saying? Like what is it? Just
Well, it's asking
Signs and
symptoms of bruxism, and
It's just
saying increasing the effects on sleep.
So like how many you just have to like read off.
So read the first, like severe attrition.
So just like find where it says signs and symptoms, and just literally like that's the machine.
Oh yeah.
So like she's like the dental. Yeah. So it's like some of the things. So she like also like different but she has yeah, that's a big one.
I'll send you.
Oh, AJ, how's your case presentation and data collection sheets?
Okay.
I'll get a friend. Card numbers.
Okay. The chair of the program.
Fourth floor. Right here.
Right next to the bar room.
That's a. Okay, I don't know what it is. Gotcha. So I need to get my thing signed. You just go up to him and ask him to sign.
What?
Forgot to ask the bank.
And like, because it gets that signature.
I just decided, I just figured out.
And it says to get him an order, so like, just go up to him and ask him, hey, I guess it's signed.
It doesn't.
You have to go buy
Yeah, they said like Hannah was looking at dresses and they were like wrong dresses.
to first one to wear
So,
dresses
do we have to
like
wear tux?
Yeah, and then
Rent it, bro.
I was like,
Rent tux.
this is just
Rent
what I
it.
was doing, and I found out the kills.
I'm not wearing the tux.
It's at 1 o'clock,
really
right?
What are you talking about?
Like,
Instrumentation.
Yes.
seniors, I don't really
It's at 2 o'clock.
know the seniors.
And it's not
their
bad.
thing.
Let me check. Let me
I
check.
know a bunch of juniors that are.
I know.
They're famous and stuff.
Plus, it gives money to us next year if we don't go, so.
Yes.
Yeah,
because
less-
that's not coming
not-
out of the.
Not paying for plates.
Yeah.
That comes out of our budget.
So even though it doesn't come from us specifically, it does come out of our stuff for next year.
People know that.
I'm not going.
I like this
Either.
Yeah, I just told Penny that.
She's like, I posted like, oh, these people, and then she's like, no. And then I just liked it.
That's why I didn't bring God.
I like the comment on Facebook.
No.
So,
Can you put ours?
Yeah, she RSVP'd.
and you saw I liked her comment on Facebook.
See what Kevin put?
No.
See what
She just said yes or no. I put no. It's not simply yes, no.
And I don't know what.
Are you talking about the communication?
Yeah. I like that one too. You're like, I didn't read it. I was gonna say that, and I was like, I don't want to say that. I knew you were gonna say something.
I didn't do anything.
Rain has this.
I'm not gonna do anything I don't have to do. When you, all he's looking for the reflections is like what you think.
Yeah.
Maybe just tell him what he said.
He just wants an opinion.
He wants an opinion. That's what he wants. He just wants you to write about what you think. He doesn't want you to report back to him.
What it says. Right? Yeah.
So it's like you just say what you think, and then like if something comes to your mind while you're reading it, then put that down.
Yeah, I write notes while I read it, so I have to go back and keep reading it. I just write notes.
Like the first one, I wrote about like it doesn't say anything about people's personal responsibility in healthcare. So I read that, and he's like, "That's a good point." On his little comment, 19.
What'd you get?
I got 19.
Me too.
I don't think.
You did too? You got 19? I think if you just take a stand and have like some kind of.
He wants to know what
you're
you
saying.
think. He doesn't. Yeah.
We have a reflection.
Well, some people just regurgitate back to him.
Yeah, I know.
what he's saying, so it's like you might as well, as long as you like.
Did
me,
you
I got
do that?
19, but it's just because no, I got a 19 because I like.
Put your own
everything
opinion.
myself,
Yeah. If you just write what it said, like a report, then you're gonna get a report grade, or not reflection grade.
Well, that's what like Hannah was typing out, and she was kind of summarizing. And I was like, no, you're supposed to.
No, that's not a reflection. That's a report.
Yeah. No. It wasn't that hard, honestly. Okay, this is just like.
We just have to not have our phones out.
I was gonna send you the study for
Where's it at first?
The red, no? I'm not sending you.
Send what?
Someone took forever on my soaps.
No?
I thought you disappeared. So that's what I was like.
Did you have a patient?
I was over here doing them on the other side, talking to Dan, and
Send it to all the people that.
I was like, these still up. I was like,
Because
like,
it was too late.
I did them already. I was like,
It was too
oh,
late.
Daniel, you didn't have a patient, did you?
In the Facebook post? Yeah, the most recent.
So I did 2 posts.
I don't think
Did
it's.
you do the training system
that's because you
restoration?
didn't reply.
The pink one?
Like in the.
I passed,
reflection
passed
one?
by 3%.
for
The passing
You
score.
did it on what's her name's patient?
Passing score is
Yeah.
83.
Yeah. Well, basically you have to join it and then apply.
Who graded you?
Did you just ask, like, can I do it? Did you ask her? Did you
I'm
ask,
gonna
like,
say
you
why,
say
so
this?
more people
Yeah, I
can
was
get on
like,
the bandwagon.
I'm
I
like,
wanna use them
I have
like for our
nothing to do.
big
Can I just look inside the patient's mouth and chart them real quick?
You should, you know what you should supposed to do? You know what you do, right? You just work on her, get her shirt number, add to your family, go off the perio table, and then just pretend like you're doing it.
Well, that's what I did. And then at the end of the treatment, I was like, can I just look inside her mouth for 5 minutes? But
It's nice because, like,
I did the foot.
tomorrow or next week, in 2 weeks, I have a guy,
File?
FPD implant denture, so like, I just have to do, I just have
Oh
to.
no, you need a minimum of 10 respirations.
Oh, he has like 6 implants, so
Okay, so 6.
No,
and
I did the same.
Yeah, 3 teeth. So.
the FPD is like the whole mouth, the whole bottom
okay.
jaw.
Oh, okay. Alright, then you're good. Cause yeah, cause it said, I was looking through my pictures, and it's like, we're doing different restorations.
Like 10 different types or just 10? Oh, he has more than 10. I'll show you his chart.
Okay.
Lunch.
Hey, where are you going for lunch? Let me know what they got over there. Text me.
I'm not going right now.
You know what they have over there today?
Like burritos.
I want that Thai one, Steve. Bro, you and In and Out. I'm down to go to In and Out. Yeah.
I know you'd be crazy with those fries.
Not, I didn't, honestly,
The 10 pieces.
honestly, I've been eating like that peanut stuff, that peanut stew I made.
Peanut soup from like 3 weeks
Oh,
ago.
how was it?
With rice. It's so good.
Really?
Almost like, I don't think I've had any, I think I've been like vegetarian the past week. Yeah, I don't think since Saturday I've had any meat. It's lunchtime, bro. Of course she's not gonna be there. Just drop it off. Don't even be there. Is that the Puerto Vallarta trip?
Yeah.
I guess I'm gonna be going with you.
It's only a week. Did you do this one?
No, I didn't do it yet. I need to talk to my parents.
I just need the signatures.
And I need my passport to come in the mail. It's in the mail still.
Mine came in.
Are you guys going on a mission trip?
Puerto Vallarta.
Oh, that's
Are you? Are you going?
not that one.
Say different.
Wow.
Exotic vacation.
17-hour flight. Yeah, far.
Wait, is that the...
And far, yeah.
That's in
That's what Moretta said. Moretta's like, if I ever get a chance
You
to go
have
on
to
a
do
trip,
it.
I'm only gonna do the close ones. Because
How do you do it? You just go...
You
and-
just
You
travel
fill it
far.
out and then you.
Cause
just
he's
let
like,
them
he's
sign
like,
it.
I
They
can only
kind
be
of
away
send the-
from work like
So
3
We get to
days.
get Barbara to sign it,
Cause
and
he's
then once you
working.
get Barbara to sign it, you go. or
I'm
not
like, that
Barbara,
makes perfect sense.
Yeah, Marshall.
He's like, the only
Yeah,
ones that are
Marshall will
worth
sign
going
it,
to
and
are
then
like
bring
the
it up
short
to the
flights.
office and drop them off.
And he's like, cause he's like, all right, look,
So I just have to get this done and
cause
drop it off.
think about it, like your Palau trip, 2 days are just gonna be traveling. So you're there for like a week, 10 days, 14 days.
It's like a long duration.
Okay, so 12 days are working, so you're gonna lose like 2 whole days just flying.
No, well, I said that it was like just take something while you're.
What airline are you going on? Don't
And I was
know.
like, what if I
Spirit. Oh, you're gonna get the Spirit.
No, they take it so long ago.
Blue, JetBlue?
It's gonna be
flight is just
Air Canada.
No, I'm terrified.
You're afraid of
It just
flying?
says Venice
No,
Spirit.
It's gonna
I
be
am.
what?
I'm
Wow.
terrified.
You should have Dr. H prescribe you propranolol or something.
No, I don't want
He's always like,
Mid-flight?
just ask, they'll give
Oh, we
it
gotta
to you.
head back,
Like,
guys.
I'm scared.
They did that.
Experimenting with
when he, what was it, when he was talking about, I remember he was talking about propranolol last quarter, and he's like, if you ever have to do a large presentation in front of like thousands of people, take propranolol.
Did her dissertation for
Like
for times like that.
Yeah, he's like, you feel fine.
You're like, whatever.
It's like so
Is that the one where he's like, oh,
typically
yeah,
it feels like
yeah. And I don't know if it was that one, but he's so goofy.
He's funny.
He is funny, I like him. Oh my gosh. What for effects on T? Neurostomia, bruxism.
I put into which number?
3.
I just
Hair facets, hyperkeratotic ridges on the cheeks,
Okay, a lot. Okay, where faucets? Hyper what?
hyperkeratotic ridges on the cheeks. Swells tongue. And impressions of incisors on lips and noses. Yes, I'm sorry.
And noises? Oh, my husband does that.
It also mentioned enlarged neck circumference.
Yeah, that's for number 7.
Number 7, I've done.
I don't know if it's because of that. It's kind of giant. What did you say, AJ?
Oh, that's for number 7 for metabolic dysfunction.
Wait, neck.
So from 7 is just the endothelial dysfunction and the increased neck circumference.
Medcom should be 5 units and have most of our time. Yeah, because it applies to us the most. Because this is so like life-saving and important. I forgot all about it. No. I mean, when Mason was telling this, I can't breathe. I was like, just lay down. You're supposed to say that.
Did you do injections yesterday?
Yeah, I did. I don't think I passed.
They didn't tell you?
She didn't tell me. I don't think she knew I was taking orders.
That's right. Hey, what'd you have? Don't hide that.
Oh, she's the hard one. They
She's
met.
nice and she said I did a great job, but it's just one.
No, yeah, we found out though the hardest person with injections is Miss Lennon. Miss Lennon will not pass anyone on injections. She'll be like, your hand was like this. It was supposed to be like that.
Yeah.
She'll be like, that's a fail.
There was a lot of
Your hand's
things-
like
I didn't review for it at all because
90 degrees.
he told me he wasn't going to let me do them, so I didn't review. I was like, well, okay. And then the last minute, he's like, okay, fine. And I was like, I'm just going to wing it and go with my knowledge. And I'm pretty knowledgeable about it. You didn't even study? But the question she was asking me, like, oh, which way should the bevel be? And I was like,
to the bone.
And she's like, but is that towards you in this one or away from you? Or up or down? And I was like, there's no other way.
Yeah, she does
And I was
that.
like,
She does that.
And then, like, my hand, you're right, it was like, I was picking it up like this, and she's like, always pick it up like this, so you can flip it over. And I was like, I wonder if she's giving me constructive criticism, or
No, she wants us to pick it up like that.
She's like, put it this
She
way
wants
so that when
Miss
you
Lee
just
wants
pick
you
it
to pick it up like
and
this,
I was like,
grab it like that, and then flip it.
These weren't things that that wasn't specific things when we did anesthesia, though. It was
She
just
taught
free-for-all.
She taught me and Daniel that, or Daniel and I
It was a
that.
great learning experience,
She showed
but I'm
me
like,
that
was
too,
that
but I
you
didn't really
telling
like
me
it,
that I
you know.
didn't pass because you had
It's
to
like
tell
you
me
place
something?
it so that all you have to do
So I
is
don't
just
know.
pick it
And
up.
she wanted, and like another thing is she wants you to move like the stand. The stand, you pretty much move that right over the patient's chest.
Yeah, you have to.
When-
But then they can see the needle.
Yeah, because she wants you to have the needle, she wants you to have the syringe in
Right
your
to the
vision the whole time. She doesn't want you to like do this and then come over. She's like, you have to have it right like
That
in
makes
your
sense,
view.
but like, you don't want the patient.
It's kind of overkill.
That's kind of.
Mine wasn't over the chest, but she had it like
It's
this.
it's overkill though because
It's like-
Moretta's just like, I don't care, just do it.
I was just like,
You
this.
know, like it should be here.
Like during Vespers, he's like, just I'll sign it. Just I'll watch you do it. If it looks like you did it right, then you get it.
But you can say
he's like, don't tell anyone I said that.
AJ's over, this part is over.
Don't hurt me.
Wait, you can sign it?
No.
Oh.
Okay, that's to be residential.
In dental, well in dental school they don't even have the comp.
Yeah.
So did you when you
I'll be like in dental school, well it's like no comp. They don't do comps. They literally just do like.
It's like evaluation.
The dental students are scared of them.
Yeah. They're like Christian over here doing injections. His hand, he was with you that time, huh? Was his hand shaking?
He didn't give it to me. He gave it to Jessica, and he was like, I shit you not, the needle was like this on the He's like, I'm gonna penetrate right here, and it should ended up over here.
He's like, I'm gonna penetrate.
I didn't remember the talk though. Sometimes like AJ, you need to start talking about what's going on.
You're so quiet.
I was just like, I was just doing it.
I'm like, just talk about it, keep talking.
I was just doing it like, oh, okay.
Laura was just, she was all open for you. I put it in there, and then after
Miss,
a while, it was
yeah, Miss Armstrong, I feel like she's gonna be like the easiest one who's grading injections.
Yeah.
She'll be like, it looks like you did it right.
Yo, but she's like straight old school, dude.
She's like, no, but she's the most whatever when it comes to grading. She's the nicest grader. If you have like, Miss Fadala is a little bit more relaxed too, but like she still wants to do. She was doing, yeah.
And I like, what's her name, Reyes.
I haven't had.
She teaches you a lot.
I haven't had, the one person I've had so far in my rotations is Miss Lee. I had Miss Fadala once.
And Armstrong.
And Miss Armstrong, yeah.
I
know, you have
Miss Videla, Miss Hayden.
Yeah, you have Miss Hayden, Miss Fadala, Miss Reyes, like all easy ones. I have a patient, Miss Lee and Miss Lennon. Like, I'm just like, what the heck? I had like the two strictest people, like.
Like, AJ has no idea what he's doing.
Oh, he doesn't have
The thing, the crappy thing though is the crappy thing about those, like our evals are not based off of that. They're like, oh, at the end they take the average of like all our like our things. So like, if you have hard instructions the whole time, you can't. You really think they're doing better than me?
So like, pull it down, like it can't
Some people come out to are supposed to be like, AJ's coming out with twos.
Yeah, I'm coming out with twos, and they're like, yeah, like,
yeah, I know.
So like, if you hang it on one side, then you have to turn it like forward, and then if you like want it, if you want to work.
I think at the end she like messes around with it.
Yeah, she knows.
She knows.
The suction from like front to back or something, and then hang it on this side so that you can work on this.
Hey, those Dell students are gross though. Like, they didn't clean my cubicle at all in the morning. I had like bloody floss hanging from my.
Why are they so dirty?
Because they don't have to clean anything. That's why they're not graded on that.
What was their what must their personal hygiene be? Probably nasty. I feel like
I always think of that when a guy's like dirty, I'm like, ooh, it must be stinky in there. You can't clean up here. I don't know what's going on down there. You clean up after yourself. Just saying, like, ooh, probably. You stinky. Oh man, going crazy. What's the next side? Oh man. I'm not gonna lie, I need a drink. I can't read anymore. I'm gonna get you drunk right now. You want to get me drunk? I do. Don't call me like Adrian coming out. That's okay. One shot is cute.
Like the worst thing ever.
I know. She's
Start
like, I
off
hate
with
you.
good stuff.
I'm like burning.
It's the worst. I was thinking of like Drambuie and stuff.
Drambuie? How are you? That is an old man's drink.
Like, it's so like, here, take a shot.
Oh, that's some old school stuff.
Absinthe?
Everclear.
That's disgusting. That's good if you mix it in like a juice or something, but oh, serious.
I think even then it's still pretty good.
Still gross. You might have to add like a liter of sugar.
Bacardi 151.
What?
Yes.
The stuff that starts on fire.
Just let everything break down in there.
I don't even think they sell that anymore. I think they stopped
We
selling
would
it.
have to have a final
Just grab some.
right after the final.
I remember me and my brother, I bought like just the bottle for me and my brother, and I was like, dude, I can't drink anymore.
Yeah, it has to be like
He was like,
this
I
day.
was like, dude, I was like, my breath freaking burned after, like, I'm just like,
Yeah, that's like moonshine. That's that shit's hard.
151.
What day is it? I don't even know what day of our final.
It's super high
I want to say
temperature.
it's the 6th. It is the 6th.
Sorry, babe. Going to
It's like what?
Nice to see you.
Stronger than
Nice to
moonshine.
meet you. You're gonna like me better when I finally see you.
This is like the strongest you can buy at the store.
Yeah.
What did you guys get for number 3?
Because I thought moonshine
I am
was
so
supposed
over this assignment. I'm like searching
like
this
drinking
whole
gas.
Well, see, someone can
Hold on, I
make
have
moonshine
one
and it
more
can still be low. It
Oh,
wouldn't be
God,
high
Angel. I'm
concentration.
almost
You can make a
done with the
moonshine
first one
that's
and
like
I'll hair drop it to you guys.
20%.
Oh, I did that one.
It's still moonshine.
Oh, I am Ariana.
So the real
I
like
did it when we went to
Tennessee high grade
tournament.
ones.
No, but it's
Don't
really
they
kind
sell
of
it?
thick.
Oh, no, I was like over here typing away.
10, distilled 10
I need
over
it
it.
anyway, but I'm almost finished the second one. I'll
Just
send you guys,
straight
and then you
0%
figure out
water.
Whatever you want to do.
I'm on number 4 and I'm like, where?
Lab grade.
No, it's making me mad.
Straight ethanol. Runs a car.
It's a bunch of things, Tiff. It's a bunch. Just
But
what you
it's
just
just that
sent.
red alcohol that they sell at the pharmacy.
I don't know, dude. I can't
There's
drink
some
it
versus the
anymore.
where
In Mexico, they drink that shit
Bridges empty.
straight up for rubbing alcohol.
Grinding teeth are like,
You shouldn't
what I'm
drink
saying?
rubbing alcohol. You can
But
go
it's like,
blind.
there's two types in
Oh,
Mexico.
I got
Is it
that
the
okay.
There's two types of rubbing. There's a red capsule and a blue capsule, and they drink the red one. Wow, they're crazy.
We're micro arousal. Yeah, see, I don't see that anywhere.
Medical? Which one? I'm not doing the sleep apnea one.
They're my favorite.
Did you do number 9 anyway?
Almost like
Sleep apnea assignment? What is it?
What's number 5?
Number 5? 4 out of 100 and 2 out of 101.
Like 4 out of 100
4%, 2%.
for men.
Yes, 4% men, 2% women.
Where'd you get that number from?
It's in there.
Oh my gosh.
Number 9's overweight. Overweight.
Chronic vascular disease, hypertension, congestive heart failure, arrhythmias, and
Where did you see it? That's when you look in the book?
stroke and heart attack. That's crazy. Oh my gosh, I didn't bring my chocolate.
Sucks to be you.
It's my emergency supply. You bring it? I brought everything. Somebody ate it. I had it on the counter. Are day I quit. How'd you guys do on the math test? I probably don't even want to know. You guys are all smarties.
Did you do better than me?
What'd you get?
Did you do better than me?
What'd you get?
You're like
That's what I'm like, how'd you get that?
I don't know. She was like,
I know.
Did you get the 42?
no, I didn't get that.
It was me.
Good job.
Did you get money?
I don't like to look at that.
You get money. Do you get both the package? You get like
Chart?
Like if there was
Yes.
like, yeah, like
Are you talking about the box plot?
yeah,
It shows the high, low, average.
yeah, and then it shows like how many people got what score.
What? Where does it do
Not
that?
like number wise, but like
Oh, well, yeah, box plot shows that. So, like,
Yeah.
the inside the box is like 75% of the people. Right?
yes.
That's how a box plot works. So, like, the arrows outside the box plot are like where the average, or like the high and the low.
I don't know if it's okay. If you guys help me with this question, I'll airdrop this to you.
Okay, go.
Give me some treatment modifications to someone with sleep apnea.
Type 4.
Yeah, type 4.
They have dry mouth, right?
No, no,
So-
treat.
Oh, yeah,
Sit
the
up.
treatment. So I put
with some pillows.
semi-supine. What else could I do for treatment? I don't know.
Night guard. Night guard. CPAP.
This thing.
A nose.
But this is treatment.
A nose.
Where'd you see that?
It's number.
Is that? Did she email it to us?
A nose.
No, it's just, it was like.
One of the nose sleeping strips.
Where'd you find it?
Yeah, Patty.
Where's that?
my school. I have a
Communication on
Videos?
What?
Your friends coming home.
Just click on it. Well, for like the app, the Canvas app,
How'd you get into this?
for like the Canvas app, you can like click on the grade and then I'll show you details sufficient and then like your grade in the class tab. I can't do it on the computer? I don't know. You probably can.
What did I see later?
Please don't scroll. Please don't scroll. Please don't look at my grade. Please don't look at my grade. It's trash.
No, see, look, it's just the plot.
So lunch to eat.
Oh,
And then I'll
that's
come back.
weird.
And then I'll be in lunch.
Let me check my app. Because I have the app too.
I'll show you how to look at it.
Yeah, I would go with CPAP machine.
I didn't.
Weight loss. Tell them to lose weight.
All this?
Tell them to stop eating.
Oh, mine's on. It's on that.
Go on the sleep diet.
That's what I'm on a keto diet.
Just don't sleep ever.
Yeah.
Because then you won't have problems.
Actually, just tell them to disappear.
Couldn't we use nitrous for that?
That no.
You probably fall asleep on that.
But they're like semi-fine using nitrous? Okay, whatever. Send me,
Alright.
I'm gonna give you guys this, but send me your answer to number 10 or 11. Okay. And take your name off.
Actually, I didn't risk it.
Use of a CPAP or oral appliance or night guard
What's a CPAP?
or night sleep guard or it actually says weight loss.
So what do you do? Carb cessation? Do that.
Carb cessation.
Yeah.
It's a scientific word. Carb cessation.
Yeah. It says reduced alcohol intake.
Thank you for talking to Mason, by the way, while I was He's cool, I like talking to him. Because he was
In the blue one, it says a saliva stimulant.
kind of like puts it down, kind of like, it's good that he sees where you're studying, he sees what you're doing, you're spending time doing, where you're studying. I think it makes it more real whenever he hears it from someone else. Oh, yeah.
Increase water consumption.
Brandon's alright. I told you that for 5 years now. You telling that to him, like, it's crazy.
And to lower caffeine and alcohol use.
Walked outside and I was like,
The blue bar, it says treatment plan modifications.
and stuff like that, and just since I was going so slow, I was like waiting for him. I just actually whatever. The whole situation, I just felt like everyone had eyes on me. I was doing terrible.
You can't. You're one of the best clinicians. Stop.
Well, yeah, that's how I felt on the inside, just coming from being so overwhelmed. So even time I
And I put fluoride as recommended to reduce caries.
Okay, I'm gonna send this to you guys so have your
I think if you do it, don't say one word.
If you need it.
No, I'm just do not tell her.
What is
Then
it?
she'll bring it up and be
It's
like,
an assignment.
actually.
Or what?
Go over the tournament.
The one we just did?
Yeah.
Oh, I just did it.
Oh, are you done with it?
Yeah.
You should have just waited.
Field trip to Harvard.
No, like I was filling it out with you. Like, see?
Mine's
like boards college where these issues and she's all like, you still can't find a patient, which is going to get him up. And I was like, don't I need those things too? And she's like, yeah, you have a year plus to figure it out. And you have people that are trying to graduate that can't. So it's a yes or no. And she's like, karma, if you let them go,
Daniel, did you want it?
No, it's fine, thank you.
Karma. And I was like, thank you.
You're welcome.
I'm just gonna say,
You want it?
I'm so sorry. I feel so awful.
Yeah.
But like,
Just kind of change
that's
stuff.
like your career. Like that's. Well,
That's
and
your
then,
future.
then I went outside and I started crying and I was like, I'm trying like, and she was kind of like looking at me like, yeah, she's like, it's up to you. Because I need to be passed right now, but and I was like, it is up to you. No, she shouldn't. If it were anybody else, I'd probably say yes because I'm the only person to ask. Like, I would give my left arm to somebody type of thing. But that's my boyfriend's family. I want to Are you making fun of me?
No, I'm just laughing at.
Would you give up a board's qualified patient to a senior?
I don't know. To be honest,
If it was your girlfriend, I can quote
Probably-
AJ. He
I don't
said,
know.
I'm a greedy clinician.
I
So,
said that too. I said I'm a greedy clinician. But like, see, like,
Would any of you guys give up a board's patient?
I might do it. I might do it. I might do it if Miss Lee asks me because I need to get into dental school.
If I had a backup, maybe.
Yeah.
If I had a backup patient.
I would. I might do it if because I'll be like, well, Miss Lee, I want a good letter. That's what I tell her. I want a great letter of recommendation.
I wasn't even thinking about that.
Well, see, you're.
I'm the person to just be like, yeah,
It's
sure.
we're in different chairs though. Like,
Yeah.
so it's like I'm trying to get into dental. So I'm like, well,
Right,
Miss
right,
Lee,
no,
if you wrote me a
that's
great letter of recommendation, I might be inclined to
you
do
have more on the
that.
line to think about. Whereas
Yeah,
I'm just
what,
like,
like
I'm out of here. And I know
You
how
guys
hard
can
it is to
leave.
come by a board patient, so I'm just like, well,
Yeah.
I need to read.
So no,
get
stop.
them
You
to
guys have a
practice.
board patient.
Yeah.
Don't tell
Any
anyone.
board's qualifications.
Oh, I'm not even bringing them in yet. I already have
Oh, yeah,
like
mine-
I know people. I'm not even bringing them in.
I haven't even brought any of mine
That's what
Parents trying to let their teeth get worse.
I was told by the seniors. They're like, don't even bring them in because
Yeah,
they're gonna try to
my
take them
big
for other
told me.
stuff.
Because my big was like, it's not even worth bringing in patients right now because, like, you're getting patients that you need from the school. So, like, if you know your
Yeah, but you're
patient
getting
is,
people that are on 3-month recall that don't need x-rays, don't need injections, you know?
but, like,
I try to
she's
just
like, you'll
get-
find them. You'll, like, dental students or, like, anything, like, you don't need them now. Like, you start bringing in your patients, like, at the end of next quarter. At the end of summer, your
I
baby's
was
good.
told, yeah, I was
She fills
told
you
that
in.
during summer.
Yeah.
Once everyone else is gone, it's just
Yeah,
us. Bring them
because
in.
then, like, there's, like, a possibility that your patient's gonna be taken away from you for whatever reason. Like, if, like, it is a
No one's
board
taking
certified
my
patient, then, like,
I mean, unless
you
it's
need to
like,
look at that.
I'm not gonna be selfish, but it's like, I don't know.
Yeah, because there's even seniors right now that aren't done with competencies, and they're like searching, like FMX comps. Like it's like a simple like comp,
They're
but like they're
searching for that?
still not.
I just asked
yeah.
dental students for those.
I went in there and tried and it was like crickets.
Go to
Yeah, but that PM clinic, that's understandable.
go to the what I do is I go to the attendings, the ones in the green,
Yeah.
like Dr. Kim, who was in Miss Lily's thing. I just said, "Hi, Dr. Kim, I'm AJ Briano," and she's like, "I remember you," and it's just like go to people you know that will somewhat know you, like Dr. Kim, and just be like, "I'm looking for an FMX patient. Because I have a competency," and then usually like one dental student will try to suck up to them and be like, "I'll offer it."
I like that.
Because if you wait by the FMX room or by the radiology, they'll be like, "Oh, sorry, I already." Because then they have to go change everything around.
Yeah, I tried that too.
But like go to the attendings because the attendings they have nothing to lose, and then like the dental students usually try to suck up to an attending.
Johnson said D3s and D4s don't even want radiology patients. They don't even want to deal with it because they don't even want patients.
Yeah. So like the other thing too is like when we go to like the school events, like the ice cream social or whatever, just try to get to know as many dental students as possible.
It's different for a girl though, AJ.
Yeah, it is.
Yeah, no, you
Who's
can't
walking
walk
up,
up
"Hey,
there.
guys."
Well, see the other thing too is I know a lot of D3s already, so it's kind of like it's a little bit
You can
easier.
walk up
Like I could just text my buddies and be like, "Hey, I need an FMX,"
Yeah. How do you know the dental students already?
because I tried applying. I've been trying to get into dental school for 3 years.
Yeah, you told me that, but how do you know?
I took classes with them.
Oh.
We got better
Talk
grades.
about it.
It's totally good.
Talk about it.
Like Dimitri Haber, he's a good person to ask.
It's just a diamond I like. It's not.
Ask. So like, yeah, I know a couple people. I just asked them.
Yeah, I'm gonna try to do
Say
the
Dimitri.
attention.
Or like, yeah, like Dimitri